I'm Chad Wilson. I am CEO of Wild Duck Labs. We're still in stealth, so you won't find me right away. We're coming out this month. We keep AI systems aligned and anchored in human intent during execution. So that just means while your workflow is happening, we're working in the background, our technology, and aligned with your workflows.
Great. Raj?
Great. Good morning, everybody. Couldn't think of a better topic than AI governance for 9:30 in the morning, so we'll try and make this as entertaining as we can. I'm Raj. I've been with MedStar Health, which is the largest healthcare system in the Mid-Atlantic region of the U.S. for about 14 years. I have a few roles there. So I serve as the Vice President of Scientific Affairs inside of our research institute, and an active investigator myself, mostly focused on things like digital health, AI, patient safety, the electronic health record. And then I also serve as the director of what we call the National Center for Human Factors in Healthcare. And there we really focus on how people do their work and how do we bring in technologies to improve that work, both for clinicians, patients, administrative side as well. So pleased to be here.
Good morning, everybody. My name is Aaron Bryant. I'm from the Inova Health System. I'm the Assistant Vice President of AI and Data Governance and Measurement Science. So I actually run our AI product management team, our governance structure, as well as overall sort of data asset management for the health system, as well as measurement and performance sciences. Those things are hard to decouple. So that is my scope, and I'm very happy to be here today. So thank you.
And last but not least, hi everyone, good morning. First, thank you very much for having me. I'm Heidi Beinrau. I'm a managing director at Manat Health, which is the consulting arm of the law firm Manat, Phillips, and Phelps. And my background's in health economics, so I work with a lot of innovative companies looking to launch products into the market, so focus on regulatory issues with FDA as well as the Centers for Medicare and Medicaid Services, CMS, and also do the mechanics of coding coverage and payment. So looking forward to talking to you a little bit about what's happening here in Washington.
Great, thanks so much. I think we're in a pretty fascinating moment when it comes to AI in healthcare, not just because of the use cases, which obviously are super important, but how we've sort of moved from experimentation to maybe implementation, and with implementation comes the need to make sure that the technology is being deployed and used safely and fairly and legally, of course. And there's a lot of high stakes considerations in healthcare. A couple of years ago, it was pretty rare, I'd say, for healthcare organizations, for hospitals, health systems, health insurance companies to have AI governance policies in place. I think surveys showed that very few did. Last year, we saw a big jump in that. A recent survey from Qventus of CIOs, chief AI officers, CMIOs, and others said that about 88% of those respondents said that their organization had an AI governance policy in place. So it's becoming much more common. At the same time, I think the experts here would agree that just having an AI governance process in place doesn't mean that you fully solve the challenge of ideal management of AI solutions in your organization, both at the clinician and the enterprise level. There's unauthorized use of AI. There's physicians using ChatGPT, right, in the workplace. Is that protected in the right way? All of those types of things, I think, are still a core issue. So let's start at the 50,000-foot view. What does AI governance look like in your organizations, and how has that changed within the last few months, or even year over year? Aaron, let's start with you with the Inova perspective.
Yeah, absolutely. So you couldn't have said something more true than it is very fluid and it is very new. So Inova has over 50 or 60 AI tools, vendors, or models in deployment currently. We just started AI governance in January, okay? So we are definitely running to catch up to do that. And a lot of health systems, as you can see as the data backs up, are in that same cadence. They're in that same running to catch up space. The way we approached governance at Inova is that governance is a team sport. It's not just driven by IT. It's not just driven clinically. It's not just driven by our business support services or our operational leaders, that we have to bring that whole group together in order to have effective governance. And so what that means practically is we've assembled what we call our AI Ethics and Oversight Committee. This committee has to meet twice monthly currently, for the practical reason that one meeting is dedicated to sheer policy and legislative and organizational approaches to AI, as well as an entire meeting dedicated to vendor and model review and approval because of the sheer volume that's coming through. We expect this year alone, and I have one of my wonderful AI product managers in the room here I hope you get to meet, we have over 100 tools under consideration for this year alone that our committee is going to have to review. And that is going to be an incredibly difficult thing for that committee to do, meeting once a month. So as you go below the line of the larger committee, we've had to build a very robust subcommittee structure. Domain-specific subcommittees, think physician and APP AI, nursing and professional services and pharmacy, our hospitals, diagnostic and imaging, finance and revenue cycle, where these key major areas are focused. And we're having roadmap development in those areas so that we're intentional about our approach to what makes it to the committee for review and making sure it ties into systemic priorities, that we only have so many resources, as I heard our cyber security colleagues mention. So we have to prioritize things. We have to make sure we're not doing duplicative efforts. We have to make sure if there's cross-pollination with tools that we're keeping that approach in mind as we move forward. And then, I think the two key elements and why I mentioned our AI product management team is in order to shepherd 100 items, for instance, through a governing body over the course of a year, having a very skilled internal AI product management team to shepherd those tools and to vet those tools with our operational and clinical stakeholders is critical. So that something does not make it to committee unless it has a high likelihood that it's going to be approved or implemented. And then all of this needs to be buttressed by a robust system to track this portfolio, track this life cycle, and track this governance. We're in a co-development relationship with a company called Signal One, who's helping us build an end-to-end platform that will both handle intake, it will handle the life cycle of a product from ideation to orchestration, implementation, and monitoring, but will also help us with the governance process in a discrete fashion that everybody's going to have a somewhat idiosyncratic governance process, helping us do that in a way that matches our governance approach. This allows us to look at AI tools as a portfolio. And I know my colleagues here from Georgetown and otherwise are thinking of this the same way, is that we have to be able to not only look at individual tools and vendors, we have to be able to pull the lens back and be able to look at our entire portfolio and say, is our portfolio safe? Is it performing well? Is it efficient? Is there return on value, return on investment? So there's the many panes of glass and the many folks that are going to want to see this all the way from the C-suite level to the head of the Heart and Vascular Institute to the person that's our chief of nursing. They're going to want to be able to look at their various cohorts of AI tools, and our health system's going to want to look at the entire portfolio. So those are sort of the three key areas that I think make up a robust governance program and where Inova is on that journey.
Yeah, it seems like Inova has got up to speed very quickly. And when you have, as you noted, so many healthcare organizations within a healthcare organization, I think that's really important. I mean, all of these different departments are going to use AI tools in different ways. You mentioned 100 tools currently under review. Wow. Chad, Raj, also from the from the provider health system point of view, is what you're hearing at Inova, are AI committees within organizations commonplace at your organizations, things that you're have deployed at your systems?
Happy to jump in first. Yeah. Well, first, Aaron, I think very well articulated. I almost feel like I should be in the audience listening and taking notes. But maybe what I'll do from the Metzger Health side is sort of just highlight some of the similarities, differences, and maybe some of the implications based off of what Aaron described. So for us, in terms of similarities, I'd say very similar timing. Our governance process stood up about 9 months ago or so. Prior to that, It was sort of individual analyses that were being done about different products, not a coordinated effort. Our pipeline is very similar, and I'll talk about some of the implications of that. Our overall process generally starts with each individual department, entity, or operational arm can choose AI products that they want to come up for review. So we don't do any of the business case analysis inside of our governance process. That's done at the individual department level. Once that comes up and they say, we have an AI product that we want reviewed, we first do an initial risk analysis, and we basically have two categories. It's low risk, meaning we don't deem there to be any significant implications from a patient safety, health equity bias perspective, or there's the potential for risk. If there's a potential for risk, then we do a much deeper dive, and it goes through a lot of what Aaron just described. So we have a small team of data scientists and others that will jump in and do the appropriate analyses. Obviously, we want to try and limit the amount of analysis that we have to do there, and so we will engage with industry and ask for model cards and any other additional information that we can so that we don't have to absorb the cost of doing that kind of analysis. And I'll come back to that as I think, a major implication. Some of the differences, I think it sounded like maybe we're a little bit more distributed than Aaron's structure there, and that business case difference. I wasn't sure if that was more centralized than our current process. I'll just spend a minute or two talking about some of the implications here because I think they're pretty significant. So as you heard from Aaron and from us, we have this huge backlog, right? So think about what that does from an industry perspective and an economic engine perspective. Right now, and I'd be curious about Heidi's thoughts on this, I sort of view this as the majority of the risk and liability is falling on the healthcare system, which means we have to do all of the vetting of that product. We have a limited team to do that. And so we have a big backlog, which means we are not going to be able to adopt a pretty incredible technology that's sitting in that backlog until we can move through this whole process. And so the more that we can centralize some kind of analysis or certification or regulatory process that would expedite that vetting, the faster we can adopt these technologies, the better it's going to be for patients, the better it's going to be for providers. So I'd say that's one significant implication that I think we all have to work through. The second one that I'd highlight is, and Aaron may have some comments, and Chad and others, is the monitoring piece of this is really, really challenging. So we can do all of this assessment early on. We can bring in our data scientists and look at things like performance in very controlled settings. We can look at potential accuracy of models. We can look at what's going to happen from a predictive capability and potential bias. But until it's actually implemented and used for some amount of time, we don't have a good understanding of the usability aspects of this. We don't have a good understanding of what's going to happen with de-skilling, potentially clinicians losing some of their skill level as they use automated tools, automation bias, all these sorts of factors that I'd consider much more of the human factors realm. We don't have a good understanding of until it's actually implemented and used, or at least pilot tested. And so that means we have to invest many more resources in that monitoring side of things, and that becomes a recurring cost to healthcare systems. It's no longer just a single assessment and we're done. This is now a recurring cost model. So just wanted to highlight a couple of those implications there.
Chad.
I bring a little bit different of an approach to the table for governance. My background is 34 years of a career in cybersecurity and 20 of it in healthcare and governance at some large healthcare organizations. Our approach that we developed and piloted in several small companies stands governance on its head. A new layer of governance is really needed for AI. AI is not just a tool that is used like a hammer hitting a nail. AI is a tool that is used at a decision layer. So a lot of companies do not have a decision layer type of governance. What decisions are made in the process of a clinical workflow, and what is the drift in those small little decisions that are made through that workflow, automated or human aligned and checked and anchored. That drift adds up to various outcomes, a range or potential of outcomes that only one is really the one that you were intending to align to. So our approach is to start with the human first. We look at the human intent, we look at the intent of the workflow and the desired outcomes, and then we align AI. We develop the technology that allows you to do it during execution, so it is not a check of the outcome or the output and then back through. It's done while it's happening. in real time. Now, when you scale that, as you guys were talking about the backlog, it's really interesting. The scale is not how do we adopt a tool really quickly, it's are we ready to grow as an organization? Are we ready to build new workflows on the same data and the same education and knowledge that we have? Is our organization leveraging that knowledge internally? And that mirror turns back to the organization. And AI tends to just highlight all of those little things that when you look in a mirror, you go, oh, I noticed that. I don't like that. So it really requires a new layer of governance, in my opinion. And that's what we've come to market with. We're a research lab. So we take our technology. We're a commercial, how do we say it? A commercially sponsored private research lab. So we take our research and we bring it out and we help businesses grow. So from a governance perspective, we look at human first. And we start all of the even at the small level of a simple workflow, all the way up to the workflow of an entire department or entire organization. And that's the layer of governance that's, I think, is really the future in healthcare. Healthcare's prime for it because healthcare is focused on the human first. It's the only industry. So we're ready for it. We've been doing it. It's just we haven't been doing it for our own workflows, and it requires, it's kind of like I hearken back to, I was a CISO at the time when mobile came into play, and we had to look at mobile workflows and what was allowed, and I had the hardest time convincing people not to use an iPhone or an Android. So I stopped very early. I didn't even really suggest it other than, hey, we need a pause for about 6 weeks to build the governance layer that we need. And then we'll deal with the backlog and go from there. A similar approach is needed. And it's not let's take a walk and figure it out slowly. The ground is shifting underneath the industry. The holes are starting to open up. It is a run with intent.
So let's look at some specific use cases and what governance might look like within those activities for how AI is being used and, in clinical settings. I think one of the most prevalent and certainly most frequently documented use cases for clinical AI right now is ambient scribes, right? So it's, you go to your doctor and there's technology recording the encounter between the patient and the physician, which, in theory and hopefully in reality accomplishes a few things. It's the physician is spending more time with the patient, not glancing at the screen all the time, and also it helps the physician with documentation later, right? Don't have to spend a lot of time after hours, after work hours, documenting what happened during that patient visit. So pretty, obvious, I think, use case, and it's saving physicians time and all of that, and I think it's rolled out, pretty well. But there are governance issues even with such a prevalent use case. There's been a couple lawsuits actually about how physicians allegedly haven't asked the patient for consent. Can this technology record this encounter? Something completely different, but also something I've been paying attention to in terms of use cases is this regulatory sandbox pilot which happening in Utah, and there's a lot of controversy around this, but essentially there's AI, the state is allowing AI technology to do some prescription renewals and fully automated, so potentially without human physician review. And it's in its early stages and it's not completely deployed yet. But whether it's scribes or something much, I think, more high stakes in terms of treatment protocols or something hypothetical, what use cases in your organization or potential use cases do you think you can sort of see challenges with governance and maybe even the committee, that some sort of board sort of rejects that use case. Has that come up in your organization? Love to unpack that a little bit. Raj?
Yeah, I'm happy to just start. So I'll use two use cases. I'll start with the ambient digital scribe since you brought it up, and I see Suki back in the corner over there, and we're have a partnership with Suki, and that's our ambient digital scribe provider. And that one, I'll say, even if they weren't here, I'd say this is a really positive one because we have such strong engagement with them as a research partnership and kind of full data sharing. So on our side, it moved through our governance process. Naturally, there are going to be some questions and potential concerns from frontline users or clinicians, and we're able to engage with Suki in a meaningful way to get a full scale and full analysis of all of the data that we have. So if there is a question about what is generated in the note, we can only see certain things on the healthcare system side. We can engage with Suki in a very meaningful way to understand what's happening on the back end. And so that really helps. So I would just highlight from this that partnership with industry is critical to making this a safe and successful process. More directly to the question about something that maybe is a little bit more challenging, we recently reviewed a product that was supporting nurse scheduling. And that's one where initially we thought, gosh, well, this doesn't directly impact clinical care necessarily. I mean, of course, any AI product, you can sort of connect the dots to direct clinical implications. But as we reviewed it a bit more, we thought, well, hold on, there are some really big complexities when it comes to nursing and schedules. And you can begin to see where there could be bias if, for example, a nurse is constantly late and maybe is late for very good reasons, right? It could be childcare, it could be traffic, it could be all kinds of things that impact nurse schedules and what's happening in their daily lives, and that could be taken in by the algorithm and start to introduce bias. And you could see how that would have some significant implications, not just for that individual as kind of an associate and somebody that's trying to do their best, but also for patient care. And so that's one where initially we thought, well, this should be a really rapid review, low risk, but we actually deemed that to potentially be high risk. And we're actually still going through a lot of vetting on that particular product.
Yeah, and Raj, I'd add to that. That's excellent. And those use cases are very practical. I guess I would pull back because I thought what was very germane to this conversation is I think any governance structure needs to take a long, hard look at their consent, disclosure, and transparency approach to AI. There's two real components to this, both to the sort of consumer and patient-facing side of this discussion, as well as clinician to clinician, how care plans are executed or otherwise after visit, summaries, what was used during the visit. This is why we are taking a long, hard look as a team at all three of those components and trying to move those consent discussions upstream so that hopefully our caregivers, our team members, our clinicians aren't having to spend a bunch of time with that portion of the discussion and can instead do what you were saying, which is face the patient and spend time and do that part effectively. So I would strongly urge everybody as part of one of the pillars of their governance program to make sure they have a strong look and consideration at their consent, transparency, and disclosure portion of things, up to and including information on your public-facing website about how AI is used at your health system or otherwise. And I know our partners here that look at legal and risk would probably have some great advice for us on that front as well.
And the tech vendors too have on their website, here's I'm sure Suki has this as well as some other in the scribe space. Here's what physicians should be saying in terms of a consent from a consent perspective when the patient comes into the appointment. Let's segue to the regulatory piece of this because it dovetails obviously really well with governance. Heidi, from the Manat perspective, there's some policymakers are freaking out about AI in healthcare. Some lot calmer. And then from the regulation perspective, from what's actually become legislation, I think there's been a lot of bills, lots and lots, hundreds of bills that have been introduced, far fewer that have been passed. What does the regulatory landscape look like to you? It seems like most of the ones that have been passed have some sort of theme attached to prohibiting like AI chatbot tools representing themselves as licensed clinicians or requiring disclosures. What does the regulatory piece look like to you, and how can healthcare organizations maybe use that as some sort of guidance?
Sure. So I had the privilege of working in Congress for a long time for Senator John McCain. And when you work on legislation, you're taught first to do no harm. So there is a method to the madness of bills coming to the floor that are more vague, because we do look to the regulators to sort of put together the specifics that are needed for, business case purposes. I think for this administration, we're seeing a very aggressive approach towards AI. We continue to hear from the White House that there's a demand that each department, including DOD and HHS and all other departments underneath, really integrate AI focus. But it is still very messy. We see a lot of frameworks coming out of the White House, especially from HHS, with some ideas, some things that they want to see in the business world. However, they're not putting any specifics around it and kind of letting y'all decide on how to govern yourselves, which, as you're hearing from these esteemed gentlemen here, they have put processes in place because we're not getting a lot of that from the federal government. And I believe that's on purpose, because they do want this to be very fluid. I think from an FDA perspective, there's concern around regulating the software as medical devices, and actually there's not that many people at FDA to be able to oversee the applications that are feverishly coming in from smaller innovative companies. So that's a challenge. But then we hear, just last week from Dr. Oz, that he wants more AI for prior authorization purposes, as we're hearing. And that makes sense because of what's happening in Utah. We've got some folks from leadership that are from Utah, that are venture capitalists from Utah, and are part of what's happening there, and they want to see their innovations at a broader national scale. So, we're experiencing a lot of challenges, but I do think what's different about this administration is there's more opportunities for you all. This administration is desperately looking for ideas on how to make this all better, and they're doing that through the healthcare technology ecosystem. And I'm not sure if any of you in the room are part of this ecosystem, but I certainly would encourage you to become part of that platform, just because it is a range of folks and specialists who are trying to figure out these problems. And so they are talking to each other. We're having experiences of large health systems, talking with payers. United Healthcare is a big part of that, trying to move their own agendas forward. Because at the end of the day, payers are probably going to be held the most responsible for what happens in AI. So again, things are moving very quickly. We're seeing a lot of promises. I'm sure you've all seen too the interoperability rules that are coming out, and that is really focused on administrative burden and relieving some of that administrative burden. So while this administration is very committed, we don't know what will happen with the next administration. And certainly if we do start seeing majorities flip more to Democrats, there could be a lot of unwinding. So that leads to a lot of uncertainty for you all as you're implementing these very expensive tools to wonder what will happen after these 4 years.
Yeah, so it seems like there's a lot of questions and potentially gaps, right? When you're a healthcare organization and you're implementing an AI governance framework and you're looking for that guiding light. Chad, how, just kind of expanding on Heidi's great thoughts, how can some of those gaps be?
I'm sorry, we've got an audience question back here.
Sure.
Sorry to interrupt.
Thank you so much. Good morning. My name is Alan Boxbaum. I'm the former Senior Vice President of Heart and Vascular for the Lehigh Valley Health Network. We were very fortunate to do some things early, and I wanted to ask the panel about one thing that kept coming up as we started looking at some of our AI applications that we were buying for really a lot of good clinical reasons, was concerns by the legal team of how the data was used to improve the product. Can anybody comment on that, and have other people experienced that? They were very concerned that we were basically helping them commercialize a product, which in my mind was they didn't understand the concept of continuous improvement from AI learning from itself. But I'd like to hear the panel's thoughts.
Yeah, I'm happy to begin. I don't think that your health system or your legal staff were unique in that concern. I know that when industry approaches us, especially in areas that are very cutting edge right now, like diagnostic imaging, clinical pathology, the way that these models are trained and become as accurate as they become is with training themselves on your patient's information, right? And not only is that good for the model that you want to adopt for care, the care coordination, care outcomes, that's great, but to the point that the gentleman made, the commercialization aspect of it, and where does that line begin and where does it end? And going back to the comments I made previously, I'd be very interested to hear our clinicians' thoughts on this as well. It's a very blurry line at this point, and we're having a difficult time navigating this with industry as well, where it makes a ton of sense clinically to work with them to help train their models, but is very much complicated by the data sharing that has to occur and how they're training themselves on our health information of our patients, and we have to be very, very, very careful with that.
I would just add, yeah, absolutely. I think the biggest concern is what's happening with those data and being able to say to our patients that their data are being kept safe or they're completely anonymized if that's going to be the process. So I think that's always the biggest concern. And obviously there's a lot of trust issues when it comes to those types of conversations. The other piece I'd highlight, and one of the things that we really try and stick to is, if data are going to be used to improve a product, that product needs to be at a level of maturity that's still servicing the consumer. So if we're going to pay for a product, then it should be at a level of maturity where we're realizing the benefit of it, and then using our data to improve it, I can sort of get behind that. But if the product is not really at a level of maturity, that really needs to be a completely different conversation and a completely different, potentially, deal structure, right? We might run that through our MedStar Institute for Innovation and talk about an equity partnership where now it's a co-development kind of opportunity. So I think that's an important line to realize there.
Yeah. I fully agree with what my colleagues have just said in response to that question. I would only also add that the procurement process itself is also part of the burden of why that can happen. Procurement starts with, hey, we have a product, we want to sell it, and how do you come in? And then you go through your legal review, you go through your cybersecurity review, committee reviews, you do all your reviews and due diligence, and then you make a decision on the product. That stack is upside down for AI, completely.
Yeah, and I would just finish with saying, the true winners of innovation are lawyers. So we have been up, staying up at night worrying about this on behalf of our clients because we do understand the sensitivity around it. And I think everyone is moving very cautiously. But again, everyone has their own opinions on how to do things internally, and your legal team is a big part of that.
Yeah, absolutely. And the one final thing I'd say in echoing everything is once your data leaves, it's gone. Once it's in a model forever. You're not going to get that back. So that's why there's the lawsuits about copyright material. The model sprawl is real. You want to control that first.
Thanks so much for that question. I want to circle back quickly to the last element of the regulatory question. Chad, I know you had some thoughts on, okay, so we have, as Heidi's outlined, federal, state health AI guidance, a little bit too vague, not very actionable, scattershot, fragmented. How can organizations fill that gap internally?
Internally, the governance layer that I recommend starts with 4 words and taking it from there. They're words that already exist in healthcare. Decisions, judgment, burden, and privacy. That's the staple of what builds trust. That trust is what drives the interactions face-to-face with clinicians and with patients and families. If we're not building the trust, then we're not moving healthcare forward. And folks like our competitors around with healthcare, like Amazon, think they can do healthcare better than every healthcare organization in the country. They've launched Amazon Health AI. So you can get it right on your phone, and if you need to, you can talk to a fake person that's going to represent themselves as a nurse. So I really do think that from an internal perspective, we have to think about that regulatory framework and in advance of the frameworks coming from federal government and state governments for those things, and building something that's robust internally that aligns, that will align with the trust, with the delivery methods that we use, as well as with the intent of providing a safe environment for patient recovery.
We're going to talk about disruption a little bit later today, but you mentioned Amazon Big Tech. As it wades further into this space, with AI being the reason why, that adds a whole new, I think, trust element and potential hindrance there. Okay, I want to close with each of your thoughts.
We have one more audience question.
Oh,
I think.
sure.
I'm so sorry.
Even better.
We've only got a few minutes left.
Even better.
Thank you so much. I appreciate it. Yes, hi. This is Sohail Azim. I'm with the South Star Consulting. We work with a lot of early stage companies that really focus on healthcare AI and look to help them grow in the industry around the country. But this question is probably a little bit more targeted towards Aaron and Raj for the health systems, and maybe a little bit more of an upstream question rather than just on the governance side. Maybe in the early evaluation of companies, when you have many different AI companies coming to you with solutions and options, and maybe they're not as developed. They're very early stage. They've got this venture capital investment. They want to look for a pilot, location. How do you all, just maybe for the healthcare system executives in the audience too, how do you best evaluate and sort of, what are factors you may look for selecting a winner, of the RFP?
I think it's a great question, and one of the things that we've had to work to tackle. I keep mentioning our AI product management team and internal team, and I think that the reason I keep doing that is they tend to be the glue between the sort of shiny object phase we're in here in AI, being able to partner with our operational and clinical and business services stakeholders to understand the idea they're trying to solve. And then, yes, they can take the vendor that this person has brought forward, but also conduct a market scan of like vendors. They can also look at our Epic roadmap and see is there something along the way. They can look at existing tools and say, are there roadmaps for their features and capabilities that might address this problem? They can help them do this decision support, or what I call idea support. And they can knit those worlds together while keeping an eye to our North Star, which is really what is our strategic goals, what are our strategic priorities for the health system, so that we're not waylaid by, again, the shiny objects, the lures that can be out there that seem like a great idea, making sure it's intentional, making sure it fits with the strategic priorities of the health system, and making sure you have true capable folks out there that can do those comparisons for you is a great asset to have from the health system perspective and help shepherd these things through at the earliest stages, to your point.
It's a really great question. I would add to what Aaron said. So for us, absolutely same thing of, it's got to be aligned strategically. I think the other really big impact factor for us is system impact / burden, right? Like, I just think about any new technology that we're going to bring in costs the system a tremendous amount. Whether it's legal review, the IT integration, if it requires IT integration, change management, all these different things are significant system cost. And especially right now, healthcare systems are just being bombarded by so many things. That's probably the top thing we look at. And the more that an early stage industry player can reduce those things, the better. So if somebody is coming to us saying, look, I have an AI product that I want to test, it does not need to be integrated into your EHR. We're looking for a lightweight pilot that maybe you can even do in a simulation environment for a week. I'm all in. But as soon as you say, well, now this has got to be integrated into your EHR, and I got to run it through legal, and I got to get all of our clinicians on board, it's just that cost is substantial, and I think is typically not weighted very much by our industry partners.
I think health systems historically have been very meticulous, and for good reasons, in evaluating tech tools, and it's probably a lot tougher to do that when AI is being thrown in so many solutions are being thrown in your face, and you're looking for evidence of that value. A lot of us a lot of this has been about, kind of the build up to AI governance, what the current state looks like. Let's look to the future for the last question. I'd like to get a one-sentence thought from each of the panelists here. What's one mindset shift or governance principle you believe will matter most over the next year or so as you think about how AI adoption is accelerating in this space? Chad, let's start with you.
Sure. You can automate decisions. You can even delegate judgment, but you still maintain the burden. And at the end of the day, patients and families want their privacy. That's the future of governance in a nutshell.
Raj?
For me, it's all about patient safety. I think that we often see a pretty significant delay in terms of when we see patient safety issues that arise from new technologies. If you look at deployment of the electronic health record, many of those patient safety issues, they didn't come up in the first few months. They didn't, obviously immediate ones did, but the very substantial ones come a lot later. They kind of work through the legal claims process, and you see them a few years down the road. So we were talking about digital scribes earlier. You know, if you look at some of the studies that have been done on digital scribes, this is way more than a sentence. There's things like documentation of misappropriation of cancer screening, right? The digital scribe picking up that the patient was screened for colorectal cancer when in fact they were not. You're not going to see that in legal claims for 2 to 3 years, and maybe not at all, and that's a significant patient safety implication.
Aaron?
Yeah, I would say briefly, just to echo the comments of my colleague, culture of safety first, human in the loop. But then what I would say is democratize the use of AI. We're going to see an agentic revolution in our industry. We are going to see the best solutions coming from the front line. So do it safely, do it in concert with your legal and security and cyber folks that you've seen today, but make sure you democratize that and put these tools in the hands of your champions at the front line, your clinicians, your operators, your business service leaders, and you will see the solutions continue to pile up. That's the future.
Heidi, we'll close with you maybe from the client perspective.
Great. I'm gonna be a little bit more optimistic and say opportunity. I think from y'all's perspective, you have an opportunity. We have more support from this administration on innovation than we have previously, and we have more funding. So absolutely going to the Centers for Medicare and Medicaid Innovation and participating in some of their models like Access and Elevate. If you are a health system that has had some success, also the Healthcare Transformation Fund, lots of money that came out of the One Big Beautiful Bill that is flowing through states. So if you are doing AI and it's improving rural healthcare, that is something that the federal government wants to hear about. So I do think that there's more opportunity to engage.